reports that every year over 1 million Americans are rushed to the emergency room with heart failure. And for most of them, the warning signs were there for months. Their hearts were struggling. Their bodies were sending signals, but nobody caught it in time. That's not just a tragedy. That's a preventable tragedy. And today I want to show you a simple 3-in-1 physical test you can do at home right now that cardiologists use to screen for early heart failure before it ever becomes an emergency. I'm Dr. Sarah Mitchell, and this channel exists to bring you the latest evidence-based medical research and language that actually makes sense. If you're over 60 or caring for someone who is, this channel could genuinely change your health outcomes. Hit subscribe so you never miss a video like this one. Now, let's get into this test and, more importantly, why it works. Heart failure doesn't mean your heart stops. It means your heart isn't pumping efficiently enough to meet your body's demands. Think of it like a water pump that's slowly losing pressure. The pipes still carry water, but not enough is reaching the rooms that need it most. Your body compensates for a while, but compensation has a cost. And by the time most people feel seriously ill, the problem has been quietly building for 1, 2, sometimes 3 years. Here's what makes this so dangerous. The early symptoms: mild fatigue, slight breathlessness, climbing stairs, ankles that seem a little puffier than usual, are easy to explain away. People blame age. They blame being out of shape. They blame the heat. Their doctors sometimes miss it too, especially during a brief routine checkup. A 2022 study published in the European Heart Journal followed 4 out of 800 adults over age 65 for 5 years. Researchers found that more than 40% of new heart failure diagnoses had been preceded by at least 18 months of subtle symptoms that were documented in medical records but never acted upon. 18 months, that's a year and a half where earlier intervention could have made a profound difference. So what is this 3-minute test? It's called the sit-o-stand heart rate recovery test. And while that name sounds technical, the test itself could not be simpler to perform at home. Here's exactly how it works. You'll need a chair, a timer, and ideally a pulse oximeter. Those small devices that clip onto your fingertip and measure your heart rate. They cost about $15 to $20 at any pharmacy. If you don't have one, you can count your pulse manually at your wrist by pressing 2 fingers against the inside of your wrist below the base of your thumb, counting beats for 30 seconds, and doubling that number. Step 1. Sit quietly in a chair for 2 full minutes. Don't talk, just breathe normally. At the end of those 2 minutes, note your resting heart rate. Step 2. Stand up from the chair and sit back down 10 times as smoothly as you can manage. No rushing, but no long pauses between repetitions either. Most people complete this in 60 to 90 seconds. Step 3. The moment you finish your 10th repetition, check your heart rate immediately. Then sit still and check it one final time exactly 60 seconds later. What you're measuring is heart rate recovery, how quickly your heart returns toward its resting rate after mild exertion. This is one of the most powerful, non-invasive indicators of cardiac function that exists. A heart that's pumping well will typically drop noticeably within that 60 seconds. For adults over 60, a recovery of 12 or more beats per minute within that first minute is a reassuring sign. If your heart rate barely moved, less than 6 beats per minute of recovery during that entire 60 seconds. That is a significant red flag for early cardiac dysfunction. Write that number down and bring it to your next doctor's appointment. A 2021 paper in the Journal of the American Heart Association followed over 3,000 older adults and found that poor heart rate recovery after even mild exertion was associated with a 3-fold increase in the risk of a new heart failure diagnosis within the following 3 years. 3-fold. That is not a minor statistical blip. That's a number worth paying attention to. But here's what most people miss entirely. The test doesn't stop at heart rate numbers. While you're performing those 10 repetitions, pay close attention to 2 additional things. First, how quickly do you feel winded? If mild exertion like this leaves you breathing hard within the first 3 or 4 repetitions, that breathlessness matters. Second, does anything feel unusually labored? Not muscle tiredness, but a genuine sense of effort coming from your chest, or a feeling that you simply can't catch your breath. Think about the last few months. Honestly, comment below and tell me, does climbing 1 flight of stairs leave you noticeably more winded than it did 5 years ago? Your answer might be more meaningful than you realize. Let me tell you about Margaret. She was 71 years old, a retired school principal, sharp, active, not someone who complained about her health. She came in for a routine appointment and mentioned almost as an afterthought that she'd been taking the elevator at her daughter's apartment building for the past year. She used to take the stairs. I asked her why she'd stopped. She said the stairs just felt harder lately. That answer changed everything. We ran an echocardiogram that week. Her ejection fraction, the percentage of blood her heart pumped out with each beat, had fallen to 42%. That's within the clinical range for heart failure. She had no idea. 6 months of targeted medication adjustments brought her back to 57%. But only because we caught it when we did. Margaret's situation is more common than most people realize, and it connects directly to the physical signs that accompany early heart failure. Signs that almost nobody explains clearly to patients. The first is dependent edema, swelling in your ankles and lower legs that appears by evening and may improve after lying flat overnight. Press your thumb firmly into your lower shin about 3 and above your ankle. Hold for 5 seconds, then release. If you leave an indentation that takes more than 3 seconds to fill back in, that is called pitting edema, and it warrants a call to your doctor within the week. The second sign is orthopedia, difficulty lying completely flat without feeling breathless. People with this symptom often slowly add pillows over months without connecting the pattern to their heart. If you now need 2 or 3 pillows to sleep comfortably when you used to sleep flat, your heart may be asking for attention. The third is paroxysmal nocturnal dyspnea. That simply means waking suddenly in the night feeling short of breath, needing to sit upright or open a window to feel relief. It happens because fluid that pools in your legs during the day redistributes when you lie down, increasing pressure on your heart and lungs. If you notice any 2 of these signs together, the ankle swelling, the extra pillows, the nighttime breathlessness, along with a concerning result from the cytostat test, contact your physician within the next few days, not weeks, days. Now, before I walk you through the complete monitoring protocol, I want to share one more piece of research that makes the case for why doing this at home matters so deeply. A 2023 study from the Mayo Clinic Remote Monitoring Program enrolled on those 200 patients with early-stage heart failure and divided them into 2 groups. One group received standard quarterly clinic checkups. The second group was taught simple at-home monitoring techniques, daily weight tracking, symptom observation, and basic exertion testing. After 2 years, the home monitoring group experienced 34% fewer hospitalizations and significantly slower disease progression. The difference wasn't a new drug. It wasn't surgery. It was awareness and early response. Here's the complete daily monitoring protocol. Every morning before you eat or drink anything, weigh yourself on the same scale in the same spot. Write it down. A weight gain of more than 2 pounds in a single day, or more than 5 pounds within a week, is one of the most reliable early indicators of fluid retention from heart failure. This takes 30 seconds, and may be the most important 30 seconds of your morning. Do the sit-to-stand heart rate recovery test twice per week, not daily. Overresting creates anxiety without adding useful information. Log your resting rate, your immediate post-exercise rate, and your 60-second recovery rate in a small notebook. A simple handwritten record is perfectly adequate. Check your ankles every evening using the thumb press method. It takes 10 seconds. Count your sleeping pillows honestly and note if that number has been increasing. Purchase a pulse oximeter if you don't already have one. Look for FDA cleared on the packaging available at CVS, Walgreens, or Walmart for $15 to $25. Your resting oxygen saturation should sit between 95 and 100%. Readings below 92% on multiple consecutive days require a phone call to your doctor that same day. 2 important safety notes. If you take beta blockers, medications like metoprolol or carved dialol, know that they deliberately slow your heart rate response, which will affect your recovery numbers. Your baseline and recovery values will look different than someone not on these medications. Discuss with your cardiologist what recovery numbers are appropriate for you specifically. Additionally, if you are on diuretics or blood pressure medications, do not adjust or discontinue them based on anything in this video. Consult your physician before changing any existing medication regimen. If your test results concern you, if recovery is poor, edema is present, nighttime breathlessness is waking you, or your weight is climbing, do not wait for a scheduled appointment. Call your doctor's office that day and describe what you're observing. Comment below with this. How many pillows are you currently sleeping with? Write your number in the comments. I want to understand what our community is experiencing, and your answer may prompt someone else watching this to look more honestly at their own pattern. The earlier heart failure is identified, the more tools exist to address it. Medications proven in large clinical trials can reduce hospitalizations by over 20% when started in the early stages. Cardiac rehabilitation programs can measure sodium reduction, fluid management, and carefully guided activity can slow progression significantly. But none of these interventions work if the diagnosis arrives too late. This 3-minute test does not replace your cardiologist. What it does is give you real specific information to bring to your next appointment. It makes you an active participant in your cardiac health instead of a passive observer hoping nothing goes wrong. If this video gave you something concrete to work with, comment testing this week so I know it reached you. And if you have a parent or spouse over 65, comment sharing this because the person who needs this most may not have found it on their own. I'm Dr. Sarah Mitchell, and this channel exists to give you the kind of clear, specific medical information that helps you make smarter decisions for your health. If you haven't subscribed yet, please do. Next week, I'm covering the 5 blood pressure numbers your doctor checks, but rarely takes time to explain, and why one of them predicts cardiovascular risk far better than the number you've been told to watch. You do not want to miss that one. Stay well, stay informed, and I'll see you in the next video.